Dr. Kenneth Kusi is the clinical trial leader at the University of Florida Health at Gainesville. His team of researchers discovered that a drug currently used to treat diabetes can also be used to treat chronic liver disease. Thanks for joining us.
Well, thank you for having me. It's a very exciting time. We have an epidemic of fatty liver disease, and this is being overlooked by not only patients but many in the medical community. So this is a great opportunity to get the word out and tell everybody that it's there and we can do something about it.
Now, this fatty liver disease, it's also known by the name NASH. Why don't you tell us what that stands for?
NASH stands by a complicated name of non-alcoholic, means you're not drinking, steatohepatitis. Steato is fat, hepatitis is what the word says, an inflammation of the liver. So your liver is getting inflammation from fat.
Chronic alcohol abuse causes metabolic changes in the liver, which ultimately produces an excess of fat. When a person who doesn't drink alcohol develops fatty liver disease, it is diagnosed as NASH.
You know, alcohol is a big cause of cirrhosis. This means end-stage liver disease.
Known as the silent killer, cirrhosis is the 12th leading cause of death by disease in the United States.
Most people, thanks God, don't drink on a regular basis, but some unique individuals are prone to collect too much fat in the liver, and that's a problem.
Right.
Whether they drink or not.
Correct.
Saying. And that's what NASH is.
Correct.
Okay.
The people who are more affected by this are those who are overweight, obese, or have type 2 diabetes. This is the type of diabetes that happens primarily in adults. There's some metabolic changes that we call insulin resistance that make that fat to be not working right. When this fat accumulates, it tends to deliver too much of something we call fatty acids to the blood.
These acids collect in the liver and turn healthy tissue into scar tissue.
One of the things that we found is that fat accumulation in about maybe 30 to 50% leads to inflammation. And 1 out of 10 is going to have that liver go bad and need a liver transplant.
How does most of that fat end up in your liver? Is it strictly diet?
One is your diet. I think all the audience knows what a junk diet is or what the right diet is, right? If you're not eating right, it's time to straighten that up, because you're not only going to get a fatty liver, you're going to also increase your chances of diabetes, hypertension, and high cholesterol. Second, physical inactivity. You got to get out of that couch after this program and go for a jogging. Fatty liver is the second cause of liver transplantation. It's going to be the #1 cause in the next 5 years.
It just amazes me, if that's the case, why it's not more known.
Yeah, and discussed.
Well, I think that it's education. This has been typically in the field of hepatologists who get referrals for people with elevated liver enzymes. And when they rule everything else out, they come up with this diagnosis. Endocrinologists are just beginning to understand what it is. And I think it is because we did not have very good tests to diagnose it. And until recently, we didn't have any good drugs for it.
Speaking about drugs, you said that there's a drug that's being used to treat diabetes that has had a great effect on NASH.
So the drug was a drug initially from Japan called pioglitazone, and the company was Takeda, and they marketed that drug in the United States because it lowered sugars in patients with diabetes.
10 years ago, Dr. Kusi was part of a group of endocrinologists who researched possible treatments of diabetics with elevated liver enzymes.
Given the mechanism of action of the drug to improve metabolism, decrease insulin resistance, and decrease inflammation, I said, let's just try it. So we took about 55 patients, gave them the drug for 6 months, and 2/3 of the patients got, cured. So we published that in the New England, and
by cured, you mean just there's no fat left in the liver?
There's very little fat. More than the fat, there was very little inflammation. About 2/3 of the patients had minimal or no inflammation. So it worked very well.
So it eliminated NASH.
Eliminated NASH, very good. Okay. Now, that was a short 6-month study, what we call a pilot study. We didn't know if the medication would wash out over time. So we designed a 3-year study in which we tested this with biopsies before, in the middle, and after. We found that the drug keeps working after 3 years. So in this study, about 58% of the patients had what we call resolution of NASH.
Meaning that pathologists examining the biopsy could not find enough inflammation to qualify as NASH.
If somebody has diabetes and they also had fatty liver, right, would this drug work, or aren't they already on it?
The American Diabetes Association's first choice is metformin. Metformin is a medication that's free in some outlets or very cheap, and reduces heart disease in patients with. So we want everybody to be on that medication, but many times it's not enough. But if you have diabetes, exactly your point, and you have this problem in your liver, this is the drug that you should choose after metformin, in my view. That is my personal view.
Already approved for one thing, right? But it hasn't been technically approved specifically to treat fatty liver.
That is a very good point. So this drug is not a FDA approved for the treatment of NASH. So your doctor can only prescribe it if you have type 2 diabetes, because this medication will improve your diabetes. So I prescribe it to patients with diabetes within the FDA approval frame. How do we find out if they have or not a fatty liver? There are some tests, a liver ultrasound, liver enzymes in a blood test. There are other more specific tests that can be done that I'm sure your liver doctor or your primary care knows what to do. And there is a treatment, but there are other treatments as well.
What happens at that point? You find out that you have NASH. How do you treat something like that?
Actually, the best treatment for fatty liver, I haven't told you yet. And guess what it is?
I'm gonna say exercise.
Very good, very good. So I can see that. We were talking that you do exercise. Both of you do a lot of exercise. So
I wouldn't say a lot.
Congratulations, you're on the right track. So if you lose weight, your liver gets better. Not only your liver, your diabetes, your hypertension, your lipids, and your chance of getting a heart attack or a stroke. So number one, talk to your doctor to be cleared to do exercise. So the more weight you lose, the better your liver gets. Studies have even shown that if you do bariatric surgery or metabolic surgery, that also improves the liver. And if you put that together with exercise, big lifestyle changes go a long way to help your liver.
When you do those changes, how long does it take for the fat to diminish?
That's a very good question. So the fat goes away fairly fast. If you're watching me, if you just stop taking those sodas, don't go to eat any junk food, in 2-3 weeks, your fat can go down as much as 25-30%.
That fast?
That fast. Now, what's going to determine the long-term harm is the inflammation, the hepatitis, and that scarring in the liver that we call fibrosis. That takes a little bit longer. And it's important to know that they're also like vitamin E, 800 units a day of vitamin E, a generic in any vitamin store, can also help. And there's some new drugs that we're looking at the University of Florida, some clinical trials that we have that can be of help.
Dr. Kusi is currently researching exactly which compounds cause a fatty liver at the cellular level.
We have a basic lab in which we have animal models of diabetes and fatty liver where we begin testing new compounds and trying to understand what are the problems that cause a fatty liver. We think there's some little parts in the cell called mitochondria that are in charge of the energy of your cells, that are a key target of this of treatment and of avoiding it in the future. But we have a lot of clinical trials.
There have been incredible advancements in the knowledge about NASH, cirrhosis, and diabetes in the past 10 years. And for the first time, there are ways not only to diagnose the disease, but to treat it.
It's never been a better time to have type 2 diabetes or a fatty liver. And that sounds
terrible.
Terrible, but we know so much more than just 10 years ago. So I would encourage everybody who's out there worried about this or thinking what to do about it, that we have ways to diagnose this, we have ways to treat it, and this is just going to improve over time. And I think that we would be glad to talk with them, guide them, and work with their own doctors to find the best the best for them.
Well, thank you for sharing your advancement in helping to cure NASH. Dr. Kenneth Kusi, thank you for being on the program.
Well, thank you for this opportunity.
Absolutely.
And thank you to all of you. See you soon.
Make sure you stay tuned because coming up after the break, our Back to Life segment.